In this video, I am going to explain in detail about the kinematics of shoulder abduction. Coming to the introduction, as you all know that the abduction is defined as the movement which tends to rotate the humerus in a near frontal plane and an anteroposterior axis. So normally the healthy person has about 120 degrees of abduction at the glenohumeral joint. Full abduction of the shoulder complex requires 60 degrees of upward rotation of the scapula. So the total range of motion or full range of abduction motion is 180 degrees, in which 120 degrees is contributed by the glenohumeral joint and 60 degrees of movement is contributed by the scapulothoracic joint. So that is your 180 degrees, 120 plus 60, that is 180 degrees of your full shoulder abduction range of motion. Full abduction usually indicates optimal kinematic sequencing or coupling of the joints across the shoulder complex. So coming to the scapulohumeral rhythm, in the healthy shoulder, a natural kinematic rhythm or timing exists between the glenohumeral abduction and scapulothoracic upward rotation. This rhythm is one of the more dominant and observable kinematic relationships of the shoulder abductions. So there is one researcher that is named Inman, who is a famous researcher specialized in the shoulder biomechanics, who had done these numerous studies on the shoulder biomechanics. So he popularized this term scapulohumeral rhythm. So this explains the kinematic relationship between the all the joints of the shoulder complex. And he reported that after about 30 degrees of frontal plane abduction, this scapulohumeral rhythm remained remarkably constant, occurring at a ratio of 2:1. So meaning that for every 3 degrees of shoulder abduction, 2 degrees occurs by the glenohumeral joint abduction and 1 degrees occurs by the scapulothoracic upward rotation. That is the 120 degrees. 180 degrees means 60 degree by your scapulothoracic upward rotation and remaining 120 degree by your glenohumeral joint abduction. That is the 2:1 ratio. So this is the glenohumeral joint contribution and this is the scapulothoracic contribution. So in this 120 degrees of abduction will be provided by the glenohumeral joint and remaining 60 degrees contributed by the scapulothoracic upward rotation movement. So in this diagram you can see the kinematics of your shoulder abduction moment, in which there will be superior rolling take place as well as your inferior sliding. Both your superior rolling and inferior sliding need to take place simultaneously in order to avoid the impingement, subacromial space reduction. So otherwise, if there is no inferior sliding, means it may, or superior rolling will be predominating and it may reduce the subacromial space and impinge the contents of the subacromial space, that is mainly your supraspinatus tendon as well as other bursa or subacromial bursa and all. So it may lead to impingement syndrome. So this is all about the contributions of your both the glenohumeral joint as well as your scapulothoracic joint, that is 2:1 ratio. So there are 6 kinematic principles which explains the kinematic interactions of the joints of the shoulder complex for achieving the full shoulder abductions. So there are 6 kinematic principles, in which the first principle is based on a generalized 2:1 ratio of scapulohumeral rhythm. Active shoulder abduction of 180 degrees occurs as a result of simultaneous 120 degrees of glenohumeral joint abduction and 60 degrees of scapulothoracic upward rotation. This I already explained in the scapulohumeral rhythm slide. So 180 degrees, which is provided by the 120 degrees of glenohumeral abduction and 60 degrees of scapulothoracic upward rotation. So that is a 2:1 ratio. This is the first principle of your abduction motion. Second principle is the 60 degrees of upward rotation of the scapula during full shoulder abduction is a result of simultaneous elevation of the sternoclavicular joint combined with upward rotation of the acromion-clavicular joint. So 60 degrees, as you know already, 60 degrees of upward rotation is mandatory for the full shoulder 180 degrees abduction. So in this 60 degrees of upward rotation is mainly produced by the simultaneous motion occurring at the other 2 joints, that is your sternoclavicular joint elevation and the acromion-clavicular joint upward rotation. Third principle is the clavicle retracts at the sternoclavicular joint during shoulder abduction. So during shoulder abduction, in the superior view, we can able to see that there is around 20 degrees of sternoclavicular joint retraction during the full shoulder abduction. So fourth principle is the upwardly rotating scapula posteriorly tilts and less consistently externally rotates slightly during the full shoulder abduction. So full shoulder abduction, there will be around 20 degrees of posterior tilting of scapula as well as 0 to 5 degrees of external rotation of the scapula. So scapula will be upwardly rotating posteriorly tilting as well as externally rotating. So this is the fourth principle. So fifth principle, the clavicle posteriorly rotates around its own axis during shoulder abduction. So during shoulder abduction, the clavicle will be retracting as well as posteriorly rotating as well as elevating during the full shoulder abductions. So you can see here, these are two diagrams, diagram A and diagram B. So in this diagram A, you can see here the acromion-clavicular joint and the sternoclavicular joint is in a neutral position, and the coracoclavicular ligament, you can see here, it is like a slackened rope. And when the during abduction, which was mainly by your serratus anterior pull, there will be an upward rotation of the scapula. During the upward rotation of the scapula, you can see here the coracoclavicular ligament is getting tight or taut. So the tension created within this stretched coracoclavicular ligament rotates the crank-shaped clavicle. So this is the crank-shaped clavicle towards the posterior directions. So during the resting position, the coracoclavicular ligament will be in a slackened position, and during the abduction, during the upward rotation of your scapula, mainly by the serratus anterior pull, you can see here the coracoclavicular ligament will be in a taut manner or will be in a taut position. This taut position will lead to the posterior rotation of your clavicle. So this is what happens during the in the clavicle, that is your rotation as well as your retraction and elevation. So this is what happening in the sternoclavicular joint during the abduction. Next, the last principle is the glenohumeral joint externally rotates during the shoulder abduction. So at the end range, there will be around 35 to 40 degrees of glenohumeral external rotation in order to avoid the excessive superior translatory pull of the muscles, mainly by the superior rolling, mainly by your deltoid. So this 35 to 40 degrees of glenohumeral external rotation is needed in order to avoid impingement of the structures inside the subacromial space. So you can see the summary of all the 6 principles. So you can see the first principle, that is 2:1 ratio, 60 degrees of scapulothoracic motion and the 120 degrees of glenohumeral motion. Second principle is the simultaneous upward rotation is produced by the simultaneous movement of your sternoclavicular elevation and the acromion-clavicular upward rotation. And third principle, there will be around 20 degrees of sternoclavicular joint retractions. And the fourth principle is not only the scapula will be upwardly rotating, it also posteriorly tilt around 20 degrees, and around 5 degrees of externally rotation is also occurring in the scapula. And the clavicle will be posteriorly rotating during the abduction because of the pull of the serratus anterior and the pull from the coracoclavicular ligament. And at the end range of your shoulder abduction, there will be around 35 to 40 degrees of glenohumeral external rotations. These are the 6 kinematic principles associated with the full abduction of your shoulder. So this is the single peak explaining the kinematic interactions of all the joints of your shoulder complex. So that is your sternoclavicular joint, acromion-clavicular joint contributions, scapulothoracic joint contributions, and your glenohumeral joint contributions. And these are the summary of the 6 kinematic principles. First principle, based on the generalized 2:1 scapulohumeral rhythm, active shoulder abduction of about 180 degrees occurs as a result of simultaneous 120 degrees of glenohumeral joint abduction and 60 degrees of scapulothoracic upward rotation. Second principle states that the 60 degrees of upward rotation of the scapula during full shoulder abduction is the result of simultaneous elevation at the sternoclavicular joint combined with upward rotation at the acromion-clavicular joint. Third principle states that the clavicle retracts at the sternoclavicular joint during the shoulder abduction. Fourth principle states that the upwardly rotating scapula posteriorly tilts and less consistently externally rotates slightly during full shoulder abduction. Fifth principle states that the clavicle posteriorly rotates around its own axis during shoulder abduction. Sixth principle, the last principle, states that the glenohumeral joint externally rotates during the shoulder abductions. So these are the 6 kinematic principles associated with the full abduction of the shoulder. So these are the shoulder abduction motion, and what are the different motions occurring at the different joints of the shoulder complex. The sternoclavicular joint, you can see here, there is elevation. So around 25 degrees of elevation occurring at the sternoclavicular joint, and next motion is your posterior rotation. That is also around 25 degrees of posterior rotation, and around 20 degrees of retraction also occurring at the sternoclavicular joint. In the acromion-clavicular joint, there will be around 30 degrees of upward rotation occurring, And in the scapulothoracic joint, there will be around 20 degrees of posterior tilting and 0 to 5 degrees of external rotation, as well as 60 degrees of upward rotation. And in the glenohumeral joint, there will be around 120 degrees of abduction occurring at the glenohumeral joint and 35 to 40 degrees of external rotation occurring in the glenohumeral joint. And why this particular topic is important means, when performed in a pain-free and natural manner, full abduction usually indicates optimal kinematic sequencing or coupling of the joints across the shoulder complex. Understanding how the joints of the complex work together allows the clinician to appreciate how impairments in one part of the complex affects the another area or another joint. So this understanding serves as an important foundation for effective evaluation and treatment of the shoulder. So hope you got some insight about the kinematic interactions between the joints of the shoulder complex for achieving the full range of shoulder abduction. Thank you for watching this video. Please do subscribe this channel and share this video to your physio friends and fraternity. Thank you.